So now that we've talked about general testing procedures, we're going to talk about cardiorespiratory tests. So when you start your test protocol, the first thing you'll do is take their resting heart rate and blood pressure. You'll want to familiarize your client with the equipment. So this is talking about your client's familiarization. You presumably have already familiarized yourself with the equipment. You don't want to wait till your client walks in to figure out how to use the machinery. So you should already be experienced, knowledgeable, know how to run through the test before your client ever shows up. Okay, but this is a chance for them to get familiar. So if you're using a treadmill for the test, then you want them to get on the treadmill, talk them through safety procedures, like tucking the little red thing on their shirt so if they fall, it'll turn off, how to adjust the ramp, let them get used to the speed, and so on. You may want to give them a 2 to 3 minute warm-up. That can occur with the familiarization. So once you've gone through the step 1, 2, 3 of how to use the equipment and you let them practice, then you can start using that same equipment to get their heart rate up before you start their test. Then you'll want to, when you start the actual exercise test, you want to follow the protocol exactly. If you stray from the test protocol, you are not going to be able to use testing norms to compare your client's performance. So, and you may not be able to compare performance forward because if you do the test differently every time. So make sure you follow the instructions exactly. During the test, you want to make sure you're watching your client for symptoms of disease that may indicate that you need to stop the test. So look for skin color, sweating, breath rate, heart rate. They start to look like they're dizzy or uncomfortable, so you want to monitor that. And then after the test, make sure they get an appropriate cool down. Don't just stop and send them home. Make sure their heart rate gets back to a normal level before you send them out. And you want to continue monitoring for at least 5 minutes after test termination. Before you start your test, you want to make sure that your client is also familiar with these indications for stopping an exercise test, particularly for these in the middle, like wheezing, leg cramps, lightheadedness, confusion, nausea, cold, clammy skin. Some of these things aren't obvious to us as the exercise professional just by looking at them. So you want to make sure they know, hey, if you experience this, you need to tell me. So they know that that's not normal. And then you're looking for these other symptoms as well as indications that you need to stop the test. The other important one is that if the subject requests to stop, you need to stop. The risk of pushing a client after they say stop is so much higher. If something adverse happens, then you are liable for that. So the risks do not outweigh the benefits of you pushing them. So once they say, like, I need to stop, they stop. So when you're choosing a cardiorespiratory test, there's a lot of different options. And so these next couple of slides are going to walk you through some things that you want to consider when you're making a choice. So 2 categories of cardiorespiratory tests are field methods and reference methods. Field methods are most commonly used. They're valid and reliable, but more susceptible to fluctuations. So, like I had said before, if you don't follow the protocol, it's not going to work. If the person is slowing down off of speed, if I do like a walk run test, I'll see a lot of times where students decide, like, this is taking so long, so they started walking and then they finish by running. That messes up the accuracy of the test. And so field methods are more susceptible to those kinds of things. But they're less complicated usually, like, hey, walk 4 laps. Like, if that's usually not hard to understand. Uh, if you have a large group of people to test, field methods are usually better because, so for example, a walking test or a step test, I can have 10 to 20 people going at a time, and they just have to record, we just write down their time when they get done. So that's easier for getting a lot of people done quickly versus a reference method that uses specialized equipment and may use a 1-to-1 ratio of personnel. Not going to be able to test a lot of people very quickly. The equipment is usually less expensive for field methods like walk a mile. You just have to have a flat surface. You could walk around the block or your neighborhood. You could walk in a gym, but you don't need a lot of fancy equipment for that. It does require that it's flat ground, and you does susceptible. So if, like, it's a mile walk or 1.5 mile walk or even 12-minute, you need a large amount of space. So if you're trying to test those outside, you got to make sure it's flat ground. It's not very hilly. You got to make sure that there's no obstacles in the way, and you also want to think about like temperature and humidity during testing. So field methods, because of the less complications and it's inexpensive, it's more common in your fitness and recreation settings. Reference methods are more common in clinical settings because they have a high validity and reliability. You follow the procedures, you're going to get the right results. You test them 10 different times, you're going to get pretty close to the same result each time. But it is more complicated in the methods of determining, predicting VO2 max require more values and more data, so there's more to keep up with. And so generally for clinical settings, that's fine. They'd rather have the valid and reliable answers and deal with the complicated. Again, like I said, you could probably have generally a 1-to-1 ratio. The equipment can be expensive, like a treadmill test or a cycloergometer can cost like $1,000. A metabolic cart can cost $1,000. So this isn't readily available in most fitness centers or recreation settings. But if you're saying you're walking on a treadmill, you don't need a lot of space for that versus having to walk a mile, you need a mile worth of flat ground. Another category you want to think about whether you want to use a submaximal or a maximal test. So submaximal tests are, we're going to go to a predetermined stopping point. That might be a time, that might be a specific heart rate, that might be a specific level of exertion, but we have a preset stopping point. So with submaximal tests, because we're not pushing them to their max heart rate and max energy metabolism, we're less likely to see adverse events. So there's lower liability, which has its advantages. You're predicting VO2 max. It's not going to be as accurate of a measure of cardiorespiratory endurance, but it's mostly used in fitness, recreation, and wellness settings because it's less liability. Maximal tests, you're going to exercise to volitional fatigue or maximum heart rate reached. And so because you're pushing the heart to a harder point, you're going to have a more likely scenario where adverse events occur, especially if you're working with a clinical population. So this is going to be more likely in a clinical or research setting where you're under the supervision of a physician. So if something happens, there's a crash cart waiting kind of a scenario. It'd also be maybe in like with professional athletes, they need to know what their maximal value is. They need a very accurate measure of VO2 because the difference between win and loss at that level is 1%. So if you're 1% off in your test because you use a submaximal field method, that doesn't help them get better. So next we'll talk about the different types of tests.